Christy Call, Editorial Director of Cure Magazine. In this edition of the Speaking Up video series, we're talking with Dr. Jeremy Brauer from the Skin Cancer Foundation on the basics of skin cancer. Hi, and welcome.
Hi, thank you very much for having me.
So, to kind of get into the basics of the disease, what are the different types of skin cancer?
So I think we have to begin the conversation of cancer really just to talk about what that means. And that means regardless of the organ, so skin is an organ, you're talking about uncontrolled growth of abnormal cells. So in the case of the skin, most of that abnormality results from genetic alterations or damage to the DNA through ultraviolet light. And then what type of skin cells are involved are really what determines what kind of skin cancer specifically we're talking about. So the most common skin cancer, the most common cancer in the United States is basal cell carcinoma. And the basal cells are found in the basement membrane or the bottommost layer of the upper layer of the skin or the epidermis. And so an overgrowth of these cells will result in basal cell carcinoma. The second, what we call a non-melanoma skin cancer, is squamous cell carcinoma. And squamous cells are found throughout the epidermis. And they happen to be not just the second most common skin cancer, but also the second most common cancer in the United States. The good news is with both of these two, what we call non-melanoma skin cancers, they have an exceedingly high cure rate when caught early and intervention is performed in early stages. The third most common type of skin cancer is melanoma. And so melanoma arises from the pigment-containing cells known as melanocytes. So they contain pigment or melanin. And while these can result in a higher mortality rate, fortunately, in general, when melanomas are also caught early, or what we call in situ, meaning that they're only in that top layer of the skin, the epidermis, they too approach the similar cure rate to both the basal cell and squamous cell carcinomas.
Okay. So what are, I guess, the big differences between skin cancer and melanoma?
Well, so melanoma in my mind, again, since it is derived from a skin cell, really is a skin cancer, but we do break them up in general between non-melanoma skin cancers and and melanoma. And so the non-melanoma skin cancers, primarily basal cell carcinoma and squamous cell carcinoma, make up the overwhelming majority of skin cancers. As I mentioned, they're the most common. And fortunately, when identified early and treated early, have a high cure rate. Melanoma, similarly, if found early, can have a high cure rate. However, if not, it ends up being deadlier than both basal cell and squamous cell. But just to be sure, if left unchecked, both basal cell and squamous cell can result, unfortunately, in mortality as well.
Right. And so what are some common causes of the disease?
Well, we believe almost 90% of all three of these skin cancers are really due to direct sunlight or UV or ultraviolet damage. With basal cell and squamous cell carcinomas, we usually think of a cumulative or accrued sun damage over the course of a lifetime. With melanomas, it's more of an intermittent sun exposure or history of sunburns. But there is that subset of patients, roughly about 10% of individuals who go on to develop skin cancers unrelated to the sun. So these are often found in areas that are not sun exposed. And we think of these individuals as having some underlying genetic predisposition or strong family history or other underlying reasons as to why they develop these skin cancers.
Sure. So going back into the difference with non-melanoma skin cancer, can you talk a bit about how these can become so advanced and maybe when patients should look to see their doctor and what they can look for?
Yeah, that's a great question. As I had mentioned before, the good news is that when these are identified early, so I think of prevention, detection, intervention, and we'll get to prevention, but primarily once, as you mentioned, these are already identified, early intervention is key. And fortunately, when we do intervene as early as possible, the cure rates approach 90 to 100% in all three of these skin cancers. Unfortunately, if for one reason or another, either they're not identified by the individual and brought to the attention of your dermatologist, or they're neglected, they can and will cause both local damage in the case of non-melanoma skin cancer. And there is still a propensity for squamous cells more particularly to go outside or beyond the initial area of injury. Melanoma, on the other hand, has a much higher likelihood of spreading beyond the initial lesion. But again, if all three are caught early and in early stages, cure rates are exceedingly high, approaching 99%.
Okay. And what in particular should people look out for on their skin?
Yeah, so in the past we've talked about your A, B, C, D, E's of melanoma, which I think are very important. I like to focus on the E, which is evolution, and really that can translate into identifying anything that is new, that is unusual, or that is changing. So without having to remember what your A's and your B's, so asymmetry, border regularity, for the purpose of this interview, we'll talk about all of them. So asymmetry of a lesion, the border regularity, color change, the diameter of a certain size. But in general, as I tell all of my patients and all my friends and family, if there is something new on your skin, or if it was already there and it's changing, or you feel as though it has some sort of unusual appearance, just something about it rubs you the wrong way, it's itching, it's stinging, it's burning, that warrants you bringing it to the attention of your dermatologist.
Okay, great. And are there certain individuals who might be at a higher risk for this disease?
There are. Just like with most cancers and most diseases, there are different populations of individuals who are at greater risk. So we talked about sun exposure, fair-skinned individuals, light hair, light eyes, who are more prone to sunburn, because we do know individuals who have a history of sunburn, especially 5 or more over the course of their life, have a much higher incidence of skin cancer, especially if they have those sunburns at a younger age. Also, as I mentioned, individuals with genetic predispositions. So there are these diseases that unfortunately people can be born with, where they're unable to repair damage to their DNA that's caused by ultraviolet light. Another population of individuals are those who are immunocompromised. So those who have organ transplants and are required to be on immunosuppressive medications tend to have a higher number or greater chance of developing these non-melanoma skin cancers and skin cancers in general.
Okay, great. And so I think, most people think that skin cancer can usually occurs in older adults, but can this happen in children and young adults still as well?
So what I like to say is we just talked about who is more likely to develop skin cancer, but the truth of the matter is anyone and everyone can develop skin cancer. If you have skin and you have cells in your skin that can go awry, as we mentioned, an abnormal collection of cells, you can develop skin cancer. Obviously, certain individuals are greater risk, but so that does include children. Fortunately, it's not a common thing to see skin cancer in children. Populations specifically that we do want to make sure we follow more closely are individuals who have a family history, as we mentioned. Specifically, family history of melanoma increases your risk of developing melanoma significantly. And otherwise, if unfortunately they are pediatric oncology patients or they require transplants, these are the individuals who we want to keep a close eye on. But in general, fortunately, the pediatric population does not develop many skin cancers.
Okay, great. So to kind of wrap it all together, what would you say is your biggest piece of advice for somebody who is newly diagnosed with skin cancer?
So my rule of threes, as I mentioned, I consider prevention, early detection, early intervention, and then if you see something new, unusual, or changing. So at this point, what you're asking is someone had already developed a skin cancer or noticed that they had that. So it's taking that next step of gathering all the information you can, and the best way to do that is really to schedule an appointment with your board certified dermatologist, discuss what the diagnosis means, what the expectations of the diagnosis are, and really review and identify what the risks, the benefits, and the alternatives are as far as treatment options for your skin cancer.
Great. Well, thank you so much.
Of course.